Good morning, students. Today we will see about the variables. The variables are the building block for the quantitative research. What is variable? That anything that can be changed or anything is liable to vary is called the variable. When the child is born, at the time of birth it is 3 kg weight. Then it may vary. One another child it may be different or color is vary, isn't it? So height is vary between one individual to another individual. So why I have to need these variables? So without variables I cannot do the research. So that's why the research is called, in the research variables are the building block for, especially for the quantitative study. Understand? So the variables is very important. Once I have to know the variables only, I could be able to formulate the hypothesis. Understand? We will see in the next video what is called hypothesis. So before going to the hypothesis, you learn what is called variable. How these variables been classified. They are classified under various sections. The first one is a continuous variable. What is called continuous variable? What is your height? My height is 155.5. My weight is 58.8. It is continuous. So this is called continuous variable. What is discrete variable? It's a discrete. How many children do you have? I have one or I have two. No. I am pregnant. So I have 1.5 child. Can you able to say? Cannot. So it is called the discrete variable. What is called categorical variable? The categorical variable is very important. Like I can categorize male, female, isn't it? That's called gender, married, unmarried, O blood group, B blood group, ABO blood group system. I divide it. So then religion, Hindu, Muslim. Understand? So in this categorical itself, sometimes we are telling male and female. It's called a dichotomous variable. Understand? So next is the active variable. What is called active variable? I am giving some intervention. That variable is called the active variable. Are you understanding? Some IEC I am giving, structured teaching program I am just giving, or some diet therapy I am giving, or some intervention I am giving. That is called active variable. What is called attributes? Attribute variable, some of the characteristics, attributes like some of the demographic variables, that's called attribute variable. For example, some attributes I have, education is my attribute, is the education versus about health. If a pregnancy versus age increase, or the pregnancy's possibilities there, like that I can, these demographic attribute variable helpful for my nursing research to correlate or to associate with my characteristics. So this attributes, this demographic, this one is called the attribute variable. Why it is we are adding attribute variable in the research? Mainly for making a association and correlation in my research. Understand? And then dependent variable and independent variable. The dependent is the effect and independent is the cause. For example, what is dependent and independent variable? Smoking may cause lung cancer. Smoking cause lung cancer. What is smoking? Smoking is the independent variable, right or not? The depending variable is the effect. If you independently is doing smoking, this cause, the effect is called lung cancer. So smoking cause lung cancer. Which one is the dependent variable? Which is the independent variable? You have to understand. Then what is called concrete variable? Concrete variable is like a measure more easily. You can be able to measure more easily. What this is the concrete, this is my BP, this is the pulse, this is a concrete. What is called abstract variable? The abstract variable is like something abstract. It's not so concrete. Concrete, everybody will be having BP, everybody will have a pulse, everybody will have a heart rate. You can measure it. But anxiety, some people very anxious but may not show outside. Sometimes they were depressed. I cannot measure it. How am I having a hope? Suddenly some people are doing a suicide. Isn't it? How can I measure the level of their hope? How I can measure the fatigue level? In what is the scale is there? Like any measurement tool is there type measure. So these are all very abstract variable. Abstract. This is a concrete. Yeah, this is the measurement is there. Then another one is called the extraneous or confounding variables. As I had told you in the VB introduction, what is called extraneous variable. For example, anemia control program. Anemia control program is one of the program, or anemia I am controlling by some intervention I am doing, and make it leads to observation I am observing. I may think that because of my amla and honey intervention only anemia is reduced during my observation. I may think that, but there are so many factors will affect my observation. Since I am giving amla, dates and honey mix for to treat their anemia, they have influenced by my intervention, my education. They may go to their house, they may take other iron rich substances or other iron rich diet, which I may not be knowing. Or so many extraneous variable. What this one, what's happening, TV or their friends are telling this is good, or some other supplements or some tonic mother are giving. How am I going to control this? So this is called the confounding variable or extraneous variable. Why am I learning all these things? As a researcher, you have to formulate, that is a hypothesis you are formulating. Hypothesis is a like a backbone of the research. To test the hypothesis only the research is progressing. So as a researcher, you have to know what is your dependent or independent variable, what are you doing. As a researcher, you have to know the in-depth knowledge about what are all the different kinds of the variable and how I have to control some of the extraneous variable and to test the hypothesis in a right manner. You need to have a depth knowledge about the variables. Hope this is a little bit informative class, and even a 5 mark question it's coming, you can just write this algorithm, and to gain mark also it will be more helpful. Thank you.